Cool, man. Well, hey, I appreciate you rebooking here. I know last time we were covering all kinds of stuff.
So before we get into this next episode, I want to give a shout out to one of our sponsors, US Dental. US Dental is one of the leading companies when it comes to a dental digital workflow. They have CBCTs, intraoral scanners, 3D printers, and so much more. So if you want to integrate technology into your practice, make sure you reach out to US Dental and ask for the Nifty Thrifty Deal.
We'll
I don't even remember everything we talked about, to be honest with you.
Man, they're still processing it, so whatever they come out with, we'll go from there. Unless you have a specific thing that you want to cover, I'm down for whatever. I kind of would like to jump into, what you're just talking about there, all the things that you're involved in and how you've kind of transitioned from, you were the guy in your practice a year or two ago when you and I were connecting, doing everything, didn't have associate, didn't do nothing. Now you got two associates, you moved out of there, you're maximizing, you got a surgical center, you've got a digital thing. So many doctors are trying to get out or get something else going on in their life. I don't want to go through that journey with you of, okay,
Yeah.
how'd you realize it? How'd you start making those things? And now how are you ultimately kind of separating, just so people could see like you can get out if you're very intentional of not just getting out, but just doing other things.
Yeah, there's quite a bit to unpack in that journey, like personal life stuff, professional life, and man, so much of it comes down to the realization, uh, multiple realizations that I've had over time of what what is my true core identity. And I know it probably sounds cheesy and all, but yet it's if you go the route like I did of like straight from high school right into college, straight from college right into dental school, right from dental school right into the job, and just like boom, 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 just make go, 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 and feeling like oh things will settle down and I'll like have time to take it easy sometime later, stop and smell the roses, proverbial statement, and uh, it's I think it's really, really easy uh, for some of us to naturally try to fit a mold that we think we have to. And that be your job, that be your social status, that be the look of that be your practice, that be your career, everything. And, sure, I've always thought it's kind of weird how, as a society, we almost ask 18-year-olds to figure out what they're going to do for the rest of their life at a stage in their life where it's
Yeah, good luck.
like we don't trust them to get married. We'll trust them to ship them off to war and get shot at, but they can't even own a gun yet, or they can't drink yet. They can, it's like, but hey, you really need to choose what you're going to do for the rest of your life. I'm like, no wonder, so many people are just like floundering around and like, I don't like what I'm doing and whatnot, and so on and so forth. And um, yeah, I went through points in my career. So 3 years as an associate, I honestly had a really great experience as an associate. I still actually work with uh, the guy that was my boss at the time. He's always been great to me, but I wanted to do my own thing. The classic thing. I felt like I needed to have that ownership aspect and be able to make the decisions for myself and have all that autonomy and everything. And it was. I look back on it now, and I think it's the right thing, but yet uh, I do think that I jumped into it thinking that I was more qualified than I probably was, and I also look back on things that I regret about my personality at the time or choices of personality, and uh, I I felt like, well, I've done this whole entire journey by myself at this point. Like this is just another step that I have to do. I have to swallow. I have to figure it out. I have to figure out how to be that team leader, motivate everybody every single day, keep everything on top, learn the business, learn new skills, grow the business, all those sort of things. I have to do it. I have to do it all myself. And the foolishness behind that of me not going into it from day one, thinking, why not have a coach? Why not have a mentor? Why not even at even the very least just a colleague to even chat with? And um, that's one of the things that I certainly regret about it, because I think that I could have gotten to a more solid place in my feeling about the identity in my career and personal life if I had stopped and let myself do that. And I can sit here and judge myself back then, like, was it pride or was it stubbornness? Maybe a little bit of everything. I don't know. Um, but if there's anybody that's ever listening right now and you're on that cusp of going out on your own at whatever stage that might be, I can't I can't stress it enough. It's like people think, oh, I can't afford a coach. I would flip it around and say, like, I don't know how you can't afford that. Or it's just like the level of importance that brings, and like the more I get exposed to people that are just, you know, the higher level that they get in their careers or profession, whatever it might be, they tend to get even more coaches, even in different aspects of their life. And I don't think that we should be any different in that regards. And as as things became very frustrating for me in my career, I I don't know how it is for other people necessarily, but what happened for me is I just naturally blamed my profession. It's like, oh, like, man, I don't think I'm cut out for dealing with all these issues that patients bring. I don't think I'm cut out for every day. All I deal with is people come in complaining, oh, I hate you, not personally, but I hate you. Like that stuff that we hear all the time. I'm like, geez, like this is getting old. And then all the issues, and you throw on employee issues and you're just like, this is the worst profession ever. Uh, Fast forward now, I I have to admit that the reality of it is like it's not the profession. It's the choices that I was making. It was the fact that I wasn't allowing myself to be of a true identity, to set boundaries, to say no. And I every now and then I'll get on Facebook and read some of the dental forums, and you'll scroll through, and there's always the sarcastic people and the people who are trying to be humorous, and you're like, yeah, yeah, whatever, whatever. And then every now and then you find that one little nugget in there. You're like,
Yep.
this guy, this gal, like they've been around the block. Like this is a good little word of wisdom there. Yeah, you know what I'm talking about.
Yeah.
And it's like uh, it's those little situations that um, those pieces of advice were those wiser individuals in their career, when they give the advice, like, the thing that you need to learn to say is no. And in a positive aspect, know where your boundaries are, as in like what treatment you are capable of doing. Know your boundaries of what you're willing to do. Know your boundaries of what environment you're willing to work in. Know your boundaries of personal relationships. Know your boundaries of professional relationships. Like, know all of that. And then know you have to learn for yourself what your true identity is and your integrity is. And once you come to that realization, then everything that you're doing is fulfilling versus just taking away from you. Um,
I think
I,
it's I think it's interesting kind of hearing you go along, right? You've been at this for a long time. And when we connected, right, you were at that crossroads of saying,
as well. Yeah.
your identity was a dentist, right? Like, I think somebody too, when you speak about that, a lot of dentists are that same way. When they get into it, they're type A. They're, hey, I'm making this. I'm going to do it myself. I'm going to get going. And then they create that identity that I'm a dentist, this is what I do. And they start neglecting other parts of their lives.
Well, and I felt guilty about it though, man, because like I'll admit I'm not, I never was that kind of guy that's like has the license plate that says something about a tooth and has something hanging in the rearview mirror as a tooth. And I mean I have one tie that has a tooth on it. It was a joke. You know, I'm like, I don't like teeth and toothbrushes and stuff like that. I'm like, I don't even want anybody to know I'm a dentist outside of this. Like that's who I am. So I'm like, oh shoot, like I don't I felt like I didn't belong.
Yeah.
You know, as if like maybe I didn't deserve to even have this career sort of thing because I wanted to leave work and leave dentistry at the door, and I would rather talk about things non-dental. And I got to where like I hated to even go to CE or local meetings because people are just talking about dentistry. I'm like, I don't want to talk about dentistry. And so then I blamed dentistry, or then I felt guilty about it all because my whole identity was wrapped up
Mhm.
in
But
that.
again,
And
your passion for me comes through with everything that you're doing, the things that you want to give back. And I'm curious, how you made the transition, because you're somebody who was clinical, clinical, clinical.
yeah,
And over the past few
totally.
years, you're doing a lot of different things, right? You have X chart, you kind of moved out, and your passion is still there, but I think the happiness is there because you're not tied up in the
Yeah.
practice. Go into that transition a little bit for me. Do you think that was kind of tied to this eye opening, being in a different kind of world, the tech world, and seeing like, hey, the opportunity comes from learning from other people and taking other paths and having other passions. When you started making that
Totally.
transition of saying, I have to get out of clinical because I have these other things going, I think you were reluctant at first. That's kind of the time that you and I
Yep.
met. I remember
Yep.
going through it
Yep.
with you, and now you're fully embracing it. I mean, you're selling your
Yep.
practice, you're doing all this stuff. Take me through that transition from, hey, you're starting to move out of it, and now you're feeling more comfortable giving away more of your practice, doing other things, but you're not stopping. I mean, you're talking about creating a surgical clinic, you're doing all this other kind of stuff, right? But you
Yep.
feel like you have that freedom. What's that transition like, man, to have that kind of started getting out of your comfort zone and ending up where you are now?
Yeah. The transition of it definitely connects back all the way to that aspect of that identity component because when I started thinking and realizing there's life outside of dentistry, and ever since I was a little kid, I've been just eaten up by like I love inventing things, and like I've always had so much dream of inventing something that would actually do something good for society, do something good for whatever profession I ended up in. Like there's such a drive of, well, if I get smashed by a bus today, I want to create something that could continue on and still do good, versus like the realization of like, well, dentistry, as wonderful as it is, and like it's absolutely amazing. But the reality of it is, it's like I can only help out one person at a time by one, like my butt in a chair helping out that one person. Um, and I felt limited by that, and then you throw on those other aspects that we were just talking about, and then all the comments that I was getting from patients, like some people saying, now just realize you can't retire until I die. And I was like, oh my goodness, like I'm so trapped in here, like they're never going to survive without me, and how do I do this? And I'm like, oh good grief, like there's so many great dentists in this world, like it's not like ooh there's anything great about me. It's just and but yet I let that just hold me in this glass box, and I just sit there, looking out like, oh, I wish I could do other things, and then realizing I'm my own worst enemy, and insecurities, limitations that I'm putting on myself. Well, I that's a choice, and it literally started with coaching, like you and myself. At the time that we met, yeah, I was in a super low time of my life. Um, yeah, I was definitely up against having to make some tough choices that, like my heart goes out to folks, other dentists that I see, on some posts. they're like, what do I do? Like, I should I just bail and sell to corporate or those are tough decisions. And I wouldn't dog anybody for whatever decision they have to do that's best for them and their family, because the biggest thing is make sure you stay healthy, make sure you stay here because you're worth it. But once having that realization that even if my profession got taken away from me, my profession didn't define me as a human. And one way or another, I could still exist. I could still make it. And also embracing the fact that if you don't take any risk, you're not going to have very much gains. And I've classically been pretty cautious, and now I've just kind of thrown that to the side, and I can thank individuals like yourself, and my other coaches, as in just like really poignantly bringing it out of me to realize a risk is worth taking. And well, I mean, just call it straight out. All through high school, college, everything, it's just like great grades, do great in dental school. Everything's, do good, do good, do good. There was no such thing as failure as an option. And that sort of stuff, especially individuals like myself, which, like I could admit, I'm definitely one of those individuals that has to be very careful about preventing depression in their life. It's a serious thing, and if there's ever anybody that needed to talk to me about it, anything, like, by all means reach out to me. I'm here to help anybody for that. Like, honestly, everything that I do, if I could help out one person, I think that would be worth it. Because I firsthand know how oddly gripping and out of nowhere and make absolutely no sense that some of this stuff can be. And so much of it for me was, oh shoot, what if I fail? Then it was my whole world would collapse. Like, I couldn't see past that until realizing that, like, I love the old the Mythbusters. I don't know if you remember that show.
Yep.
I love the one statement that I think the guy, Adam, was the guy that said it. It was just like, oh, there's no such thing as failure. It's just data. And that resonated with me, man. I know he was just, making a pun or whatnot, and then he was talking about like literal data points, but yet, wow, like, honestly, go through an exercise like, okay, let's say that somehow or another this whole practice falls, like, goes bankrupt, right? Whatever the case may be, like, okay, what next? There is still a solution for existing. There still is this is a solution for moving forward. And separating myself from that, as in to say, well, what your business doesn't mean you as a human, as an existing life source or life on this planet, doesn't mean that needs to end too. And I know it sounds trite, but yet, like, coming to that, actually grasping and accepting that reality, that was big. Because then that's what allowed me to say, okay, I have this dream, and I'm willing to risk, time. I'm really willing to risk, money, efforts, all those sort of things. And it might come to nothing. But yeah, look at all that I'll learn in the meantime. Look at all the people that I'll connect with. Look at all of that. And man, the realization that I have now is in how, the relationships that we culture as we go through. That's what it's all about. That's the sort of stuff, like, I don't care how much money you make, you can't buy that. I mean, sure, you can have people that might suck up to you, but it's like, true hardcore connections and relationships. It's a wonderful thing. And if you're closed off and you're shrinking yourself into feeling like you're just an island and nobody could possibly understand or help you out in what you're dealing with business wise, and then you're over attaching yourself as into your self-worth to that. Like you're there's no way you're open for any of that connection. And yeah, so that aspect, kicked off and started realizing it's time to take some risk. And one of the risks that I took was bringing an associate into my practice. I had been solo, thought I would be solo forever. I was so bought into the quote unquote traditional method of work until you can't barely work anymore, and then bring on an associate and just bring them on a little more, and maybe sell portions, all that sort of stuff, whatever model, and then just ride off into the sunset and whatever. Um, but I started to realize that I didn't want to be a part of, just selling and disappearing. I didn't want to create a situation that was similar to what I had to go through. I had to learn everything by hard knocks. I didn't have a mentor. I didn't have anybody to walk me through, introduce me to patients. It's like the situation I was at. It's like I got to practice on Thursday, and Monday he was gone. And here you go. Good luck, sucker. And, oh, by the way, here's the bill that you got to pay. um,
Yeah.
and I was just so impressed by stuff that I felt like just isn't right. And I remember hearing my boss when I was an associate. He made this comment like, "Oh man, in dentistry we eat our young." I had no idea what he was talking about. I was like, whatever, But man, I get it now. Like the system and how people just hire on associates and just pillage them to nothing. And I'm like, no wonder these, people burn out 3, 4 years into it and think like, why in the world did I ever do this? I was like, we're doing it to ourselves. And then you turn around and you're like, oh, well, it's like hazing, in school. You're like, well, I got beat up, so I'm going to beat up that next kid. Why? Like, why would we do that? And so I vowed to myself that I was going to try and do the absolute opposite of everything that happened with me. And I felt like the one thing that I could teach is skills. And the one thing that I couldn't teach necessarily was personality. And so without knowing any skill qualities, which my first associate, she's great. Like there's no issues there at all. But um, it was based off of personality. And I kind of cheated, I'll be honest with you, because the very first time that I met her, I happened to be visiting where she was going to school, and I had family there. And so I invited her over for a lunch on a Saturday. And my family is like, and these weren't even direct relatives. They're all, cousins, aunts, and whatnot. And I'm like, they're all up in your business. And I thought, well, they're going to find out more than I can ask because we're all bound by legalities of what we can ask. I thought, man, she's going to last 20 minutes, but we'll see. We'll see. She was there for like 3 hours, and my family's like, she's amazing. It's the best. And I'm like, and it was great. And it was just gangbusters from there. And we started at one day, and she was working for another office. And I thought, okay, yeah, we're going to build it up and then bring her in 2 days to build her up, which probably would be the smart thing to do. But, now I'm like not scared of risk. And she calls me up one day. She would remember better than me, but I think it was like 5 months into this. And she's like, I quit my other job. I'm coming to your office full time. I'm like, wait a minute. Okay. So, like, again, not a smart Adam Vega move, but I was like,
I don't know about that.
let's do this. And it's been killer great. She definitely helped build things up, and yeah, I'm not gonna lie, there was definitely some lean times there because I now had a whole other doctor that we had to support and bring that in, but I I think it was worth it. I think it was totally worth it. And then at the same time, that was literally right at the moment that I started realizing the possibilities of fulfilling a dream with this X chart, the whole software for sedation and local anesthetic tracking and everything. and how that fulfills passions to serve patients and providers. And I kind of always had a bit of a fanciful thought of like, oh, software company, you just like, oh yeah, get it done, and it just, does great, makes money. You're like, like, had no idea of how much effort and time and work it takes to do that, and how many hours and hours and hours every night. Like 7 days, it's just like 4 hours on that, just to start working on all that stuff. But the more and more I worked with that, the more I realized like, man, this was quite a passion, and I could not let it go. I mean, I was Pitbull stuck onto it, and I thought, the only way for me to do this, because now we've grown this into a two-doctor practice, and for me to like cut back, I had to bring in somebody else. And lo and behold, my associate Kelsey, she's like, oh, I have a family friend. I'm like, oh, let's see if we meet him. And the first time that I met him, kind of cheated too. We had ACLS emergency training going on at the office, so I threw him right in after shaking his hand as a patient. I'm like, let's see how you actually do. And I'm like, the guy was like the best sport ever. And I thought, this is great, because I cared about personality, just like I did with Kelsey. And they have been the biggest blessing to me, my life, my practice, that you could ever imagine. And it has been an honor, an absolute honor of on the daily. I mean, there were so many times. I mean, we still talk at the end of every day, but especially the first, couple of years, I was probably investing 1.5 to 2 hours almost every day, just going over things. Okay, this is what happened. These are positives, these are negatives, and then incorporating it, which I would love to hear what they have to say about this. They probably might say something different, but I I remembered in dental school the greatest impression that a guest speaker ever had on me in dental school was this one dentist. Sadly, I don't remember his name. I wouldn't say it anyways, but all he did was just in his one lecture was just go over failures that he had. I'm like, gutsy. I mean, you think about it, like
Yeah,
everybody else that comes is like,
yeah.
look at this amazing crown that I'm like, oh yeah, whatever, whatever, whatever. And you're like, oh, that's who I want to be like. No, this guy is like, this is a failure I had. This is a failure I had. This is a failure. And just like boom, 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 boom. I'm like, oh my goodness, like how is he practicing? But every single thing that he talked about, I remembered, and I still respect the guy to this day.
There we go.
And
Well,
so
let's do this then. As we finish up here, we got a couple minutes left, just really quick. Your passion, you wouldn't say you are, but you're a success story, just the mindset and everything where it is.
it started, man.
And you still wouldn't say that you've got it figured out, but I think you're on that path of getting there. And so, you already said anybody could reach out to you. I think just listening to you, people get it, seeing your transition. But let's finish here in like 30 seconds or so. What's your advice as you transition out for your two associates that will be taking over your practice? What advice can you give to them right now to say, hey, from what I've learned, from my journey, from my failures, from where I am, if you could just speak to them right now, what's that 30-second quick little advice of say, do this to get to where you need to be?
Every damn time you walk into that operatory, you be true to yourself. If you really know what truth to yourself is, you honor that, and you walk in and you feel like every single patient that's the most important life to you right then and there, you're going to do great, because you'll sleep well, and patients will pick up on it. The patients will follow you because they feel the passion, and that's true caring, and you can't fake it. But you have to be right within yourself before you walk in. If you're just going for money, fakeness, they pick up on it, they're gone. Like you have to start there, and everything else will follow suit. But you got to start there.
I love it. You finished like you started, man. Identity. Figure out who you are. Go in there. Take care of people. This is a guy that says he doesn't have that passion for dentistry, but man, he's got passion if you've ever seen it. So he goes out there and he puts his heart into everything he does, helping out a lot of people. Travis, it's been my pleasure to have known you and worked with you, man. We're definitely going to be connected and doing stuff. You're doing big things. So make sure we connect. If you don't have X chart, if you want to start learning all about that, we'll make sure we link to it down below. Travis, thank you for your time. Always my pleasure. Nifty Thrifty, make sure you say hi to this guy. He's in the groups. He's doing amazing things. I'm excited to see where you are in the next, who knows, man, year in knowing you, but 5 to 10 will be crazy. So
you're coming with me, man, whatever it is.
Right on, Travis. Thank you. Thanks, everybody. We'll see you next time.
Take care.